In this clinical video, we're going to be demonstrating the use of the LTM Precise laser, 800 nanometer laser, in doing a frenectomy on an 8-year-old female patient. Now, think of the result you wish to achieve when you're using the laser. Okay, remember that if this is the first time you've used a laser to do a frenectomy, take a little extra time to do it. If it takes an extra minute or two to do it, don't worry. Concentrate more on the result, and I think the extra little time you spend on it will be well worth it. So as we start the procedure, we had used a little anesthetic for this patient. When you're starting your procedures, don't concentrate on as much as if you can do the procedure with or without injectable anesthetic. A few drops is really, really effective. Here you can see we're using a short stroking motion to start opening up the frenum, detaching the muscle fibers. Sometimes we look at using the laser either in a pulsed or continuous mode. In this mode, or in this case, we're using the laser in a continuous mode at 1 watt of power. See how the laser is affecting the tissue, see how it's opening up the fibers, and adjust your power accordingly. You could use the pulse setting. In this case, I just went with a continuous because I wanted to cut through those fibers and open this up with minimal or no bleeding. So as we continue, you can see the fibers are opening up. We're going to take this back into the vestibule. How do you know when you've taken the frenum back far enough? It should be pretty much even with the rest of the vestibule. And this is a two-step procedure. The first is going to be opening up the frenum, releasing the muscle fibers, and then we're going to go back and take the wedge, what I call the wedge of tissue out, that extends up towards 8 and 9, and in some cases goes between 8 and 9. Now you are going to feel a little tension. It's a light stroke, a light brushing stroke. Don't get trying to do this too quickly. Let the laser do its thing, and as it does it, it'll open up the fibers more and more, and you'll see that there's very little bleeding, and in this case, very little patient or no patient discomfort. So we're opening that up. A little suction, if there is a little plume created, it doesn't hurt. You will get some slight charring when using a continuous mode. We'll wipe over the tissue when we're done. That's really, really a minimal, has a minimal effect. Now you can see we're starting to do what I say is the second part of the procedure. That is the taking the wedge of tissue, or that raised attachment that penetrates down to the periosteum. So we're hitting that from both sides, and we're taking that wedge out. Now don't forget to clean your tip off. You will get some buildup on the end of your tip, and that can interfere with the placement of the tip while you're doing your cutting. So we're going in, we'll get a little buildup, we'll wipe that off. We're just stroking that back and forth to remove that wedge of tissue. Again, that's a very fibrous attachment that extends up between 8 and 9. So just slowly go in there and work that. Once you start getting, or you undermine it, you take a little cotton forceps or tissue forceps to get create a little tension. And here we're going to remove the rest of that attachment. As we remove that, sort of a pie-shaped approach to it, with the tip of the pie would be down into the periosteum, and you want to make sure you get that fibrous attachment out. There, we've removed that. There's virtually no bleeding. We can go back a little and just smooth and remove any little tissue tags that are still present. And we're doing that right now, or even extend it a little further into the vestibule. And then we're pretty much done with this procedure. It's a nice procedure. You can wipe it off a little if you do get a little bit of charring. You can see in this case we got virtually no charring, just a wet gauze. That's our completed frenectomy. Virtually no bleeding. All the fibers have been removed. It's opened up into the vestibule. Post-op wise on this, very little discomfort, maybe over-the-counter meds, Advil, Tylenol, and warm salt water. Patient should really have no problems at all with healing.